I work for Healthcare Without Harm, so we are very focused on the pace of climate change and how healthcare is both contributing to the problem with its operations, but also really how it's affecting healthcare, how the extreme weather events caused by climate change really interrupts hospital operations. We're trying to figure out how to get those hospitals more prepared. And then in terms of the patients, the public health impacts from climate change are pretty severe, and they're only going to get worse. So how can healthcare really help address the impacts on their patients as part of the social determinants of health, of how they're helping people prepare their communities, what we can do to help them in that space. Climate change, as you probably know, is seen as a political issue when it's a science and medical issue, frankly. I mean, the science is clear. People can debate that if they want, but the science is clear. There's medical data as well showing the health impacts and the health harms from this. So while the projections are projections and those aren't hard facts, so far what we've learned is everything's happening faster. I think one of the key things is seeing this as a medical science-based issue. It's a cost issue as well. I think increasingly in the U.S., not just healthcare, everyone's realizing that climate risks make things more expensive. So what can we do so we're not, facing billions of dollars in losses when things continue to get more extreme in the weather, whether it's wildfires, whether it's flooding, whether it's sea level rise, whether it's extreme heat. So in order to get people involved and health systems involved with these issues, they usually first have to be educated. Most health systems don't know that healthcare is responsible for 10% of all greenhouse gas emissions in the U.S. When you're a hospital, you're worried about your patients, you have things that just happen naturally, and you might not be thinking about your energy use or the waste you produce or your anesthetic gases, which actually are vented into the atmosphere and are more potent at trapping heat than carbon dioxide. So there's lots of things that go into hospital operations that people don't think about from a sustainability perspective. But the other way we try to get them to engage is we focus on the cost, because sustainability work literally pays off with cost savings, and that's usually a big factor for hospitals. We could talk about energy efficiency, climate resilience, getting your infrastructure more ready when the time of these extreme weather events that can really impact your own hospital. It pays off in the long run. We've done analysis about all the costs if you're not prepared versus the much more minor investments to get prepared.